Valproic acid, also known by its brand name, Valproate, is a medication commonly prescribed for various medical conditions. This video aims to provide a comprehensive overview of the typical uses, dosing details, potential side effects, and user experiences related to valproic acid. When it comes to medical treatment, understanding the purpose and dosage of medications is crucial. Valproic acid is primarily prescribed for the treatment of seizure disorders, including epilepsy. It works by increasing the level of a certain chemical in the brain that helps control seizures. Additionally, valproic acid has shown effectiveness in managing bipolar disorder and preventing migraines. Dosage details are an essential part of any medication regimen. The optimal dosage of valproic acid can vary depending on the individual's age, weight, and medical condition. It is crucial to follow the prescribed dosage as instructed by a healthcare professional to ensure maximum effectiveness and minimize potential side effects. Speaking of side effects, like all medications, valproic acid may cause certain adverse effects. Common side effects include nausea, drowsiness, dizziness, and changes in appetite. However, it's important to note that not everyone may experience these side effects, and the severity can vary from person to person. If you're considering or currently taking valproic acid, this video will provide you with valuable insights into its typical uses, dosing details, potential side effects, and real-life user experiences. Stay informed and make informed decisions about your healthcare. What is valproic acid? Valproic acid, also known as valproate, is a medication widely prescribed for various medical conditions. It belongs to a class of drugs called anticonvulsants and is primarily used for the treatment of seizure disorders, including epilepsy. Valproic acid works by increasing the level of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, which helps control seizures. In addition to its anticonvulsant properties, valproic acid has shown effectiveness in managing bipolar disorder and preventing migraines. It is available in different forms, including tablets, capsules, and syrup, allowing for flexible dosing options based on the individual's needs and medical condition. Considering the multiple uses and potential benefits of valproic acid, it is essential to understand the proper dosing details, potential side effects, and user experiences associated with this medication. This video aims to provide a comprehensive overview of these aspects, empowering individuals to make informed decisions about their healthcare. Typical uses of valproic acid. Valproic acid is most commonly prescribed for the treatment of seizure disorders, particularly epilepsy. Epilepsy is a neurological condition characterized by recurrent seizures, which are sudden and uncontrolled bursts of electrical activity in the brain. Valproic acid helps reduce the frequency and severity of seizures by stabilizing the electrical activity in the brain. In addition to epilepsy, valproic acid is frequently used in the management of bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings, ranging from depressive episodes to manic episodes. Valproic acid helps stabilize mood and prevent or reduce the occurrence of manic episodes, allowing individuals to have better control over their emotions and daily functioning. Furthermore, valproic acid has also shown efficacy in preventing migraines. Migraines are severe headaches often accompanied by symptoms such as nausea, sensitivity to light and sound, and visual disturbances. By regulating the neurotransmitters in the brain, valproic acid can help reduce the frequency and intensity of migraines, providing relief to individuals who suffer from these debilitating headaches. Dosing details for valproic acid. The optimal dosage of valproic acid can vary depending on several factors, including age, weight, medical condition, and individual response to the medication. It is crucial to follow the prescribed dosage as instructed by a healthcare professional to ensure maximum effectiveness and minimize the risk of side effects. For the treatment of epilepsy in adults, the initial recommended dosage of valproic acid is usually 10–15 mg per kilogram per day, divided into 2 or 3 smaller doses throughout the day. The dosage may be gradually increased based on the individual's response and tolerance, up to a maximum of 60 mg per kilogram per day. It is important to note that the dosage for children may differ and should be determined by the treating physician. In the case of bipolar disorder, the starting dosage of valproic acid is typically lower, around 250,500 mg per day, to minimize the risk of side effects. The dosage may be adjusted based on the individual's response and the severity of symptoms. It is essential to regularly monitor blood levels of valproic acid to ensure therapeutic levels are maintained. When it comes to preventing migraines, the dosage of valproic acid may vary. Some individuals may require a continuous daily dosage, while others may benefit from taking the medication only during periods of migraine attacks. The recommended starting dosage for migraine prevention is usually 250 mg per day, with gradual adjustments made based on the individual's response. It is essential to adhere to the prescribed dosage and follow the healthcare professional's instructions when taking valproic acid. Abruptly stopping the medication or changing the dosage without medical guidance can lead to increased seizure activity, mood swings, or other adverse effects. Potential side effects of valproic acid. Like all medications, valproic acid may cause certain side effects. However, it's important to note that not everyone may experience these side effects, and the severity can vary from person to person. It is crucial to have a thorough understanding of the potential side effects to make an informed decision about the benefits and risks of taking valproic acid. Gastrointestinal effects. Nausea, vomiting, and stomach pain are among the most commonly reported side effects of valproic acid. These symptoms may be minimized by taking the medication with food or dividing the daily dosage into smaller, more frequent doses. Central nervous system effects. Drowsiness, dizziness, and sedation are common side effects of valproic acid. These effects can impair cognitive and motor functions, so it is important to exercise caution when engaging in activities that require alertness, such as driving or operating machinery. Weight gain. Valproic acid has been associated with weight gain in some individuals. This side effect may be managed through dietary adjustments and regular exercise. Monitoring weight and discussing any concerns with a healthcare professional can help address this issue effectively. Hair loss. In rare cases, valproic acid may cause hair loss or thinning. This side effect is usually reversible once the medication is discontinued, but it is important to discuss any concerns with a healthcare professional. Liver toxicity. Valproic acid has the potential to cause liver damage, although this is a rare occurrence. Regular monitoring of liver function through blood tests is typically recommended to ensure early detection of any liver-related complications. These are just a few of the potential side effects of valproic acid. It is important to discuss any concerns or unusual symptoms with a healthcare professional promptly. They can provide guidance on managing side effects or adjusting the medication regimen if necessary. User experiences with valproic acid. Understanding the experiences of individuals who have taken valproic acid can provide valuable insights into the medication's effectiveness and potential side effects. It is important to note that each person's experience may be different, and individual responses to the medication can vary. Many individuals with epilepsy have reported a significant reduction in the frequency and severity of seizures after starting valproic acid. This improvement in seizure control has allowed them to lead more independent and fulfilling lives. However, some individuals have also experienced side effects such as drowsiness or weight gain, which can affect daily functioning and overall well-being. For individuals with bipolar disorder, valproic acid has been described as a valuable tool in managing mood swings and stabilizing emotions. The medication has helped reduce the frequency and intensity of manic episodes, allowing individuals to regain control over their lives and relationships. However, it is important to note that not all individuals respond equally to valproic acid, and some may require additional medications or therapies to achieve optimal symptom management. In the case of migraine prevention, many individuals have reported a decrease in the frequency and intensity of migraines after starting valproic acid. This relief from debilitating headaches has had a significant positive impact on their quality of life. However, it is essential to note that some individuals may not respond to valproic acid or may experience side effects that outweigh the benefits. In such cases, alternative treatment options should be explored. User experiences with valproic acid highlight the importance of personalized treatment plans and regular communication with healthcare professionals. Each individual's response to the medication may vary, and adjustments to the dosage or alternative treatments may be necessary to achieve the best possible outcome. Common interactions with valproic acid. Valproic acid has the potential to interact with other medications, supplements, or substances, which can affect its effectiveness or increase the risk of side effects. It is crucial to inform healthcare professionals about all medications, including over-the-counter drugs, herbal supplements, and recreational substances, being taken concurrently with valproic acid. Some common medications that may interact with valproic acid include antidepressants. Certain antidepressants, such as fluoxetine and sertraline, can increase the blood levels of valproic acid, potentially leading to toxicity. Close monitoring and dosage adjustments may be necessary when combining these medications. Anti-epileptic drugs. Some anti-epileptic medications, such as phenytoin and carbamazepine, can interact with valproic acid. These interactions can affect the blood levels of both medications, leading to decreased effectiveness or increased side effects. Regular monitoring and dosage adjustments may be necessary. Warfarin. Valproic acid can interfere with the metabolism of warfarin, a blood-thinning medication. This interaction can increase the risk of bleeding. Close monitoring of blood clotting parameters is essential when combining these medications. Lamotrigine. Valproic acid can increase the blood levels of lamotrigine, another anti-epileptic medication. This interaction can increase the risk of lamotrigine-related side effects. Dose adjustments may be required when using these medications together. These are just a few examples of common interactions with valproic acid. It is important to consult with a healthcare professional or pharmacist to ensure the safe and effective use of this medication in combination with other drugs or substances. Precautions and contraindications for valproic acid. Valproic acid may not be suitable for everyone, and certain precautions and contraindications should be considered before starting this medication. It is essential to discuss any pre-existing medical conditions, allergies, or concerns with a healthcare professional to determine the appropriateness of valproic acid. Some precautions to consider when using valproic acid include pregnancy. Valproic acid has been associated with an increased risk of birth defects, particularly when used during the first trimester of pregnancy. Women of childbearing age should discuss the potential risks and benefits of valproic acid with a healthcare professional. Alternative medications with a lower risk of birth defects may be considered. Liver disease. Valproic acid can cause liver toxicity, and individuals with pre-existing liver disease may be at a higher risk. Regular monitoring of liver function is typically recommended in such cases. Pancreatitis. Valproic acid has been associated with an increased risk of pancreatitis and inflammation of the pancreas. Individuals with a history of pancreatitis or those at an increased risk should discuss the potential risks and benefits of valproic acid with a healthcare professional. Allergies. Individuals with a known hypersensitivity or allergy to valproic acid or any of its ingredients should avoid the use of this medication. It is important to disclose all relevant medical information to a healthcare professional before starting valproic acid. This allows for a thorough assessment of the individual's suitability for the medication and helps minimize the risk of adverse effects. Alternative medications to valproic acid. While valproic acid can be effective for many individuals, it may not be suitable or tolerated by everyone. In such cases, alternative medications may be considered. It is important to consult with a healthcare professional to explore alternative treatment options based on the individual's specific needs and medical condition. Some alternative medications commonly used in the treatment of seizure disorders include carbamazepine. Carbamazepine is an anti-epileptic medication that works by reducing abnormal electrical activity in the brain. It is often used as an alternative to valproic acid and may be more suitable for individuals with specific types of seizures or who experience intolerable side effects with valproic acid. Lamotrigine. Lamotrigine is another anti-epileptic medication that can be used as an alternative to valproic acid. It is particularly effective in the treatment of certain types of seizures and may have a more favorable side effect profile for some individuals. Topiramate. Topiramate is an anti-epileptic medication that can be used as an alternative to valproic acid in the management of seizures. It may be well tolerated by individuals who do not respond to or experience adverse effects with valproic acid. For the management of bipolar disorder, alternative medications to valproic acid include lithium. Lithium is a mood-stabilizing medication commonly used in the treatment of bipolar disorder. It helps regulate mood swings and reduce the frequency and intensity of manic episodes. Lithium may be an effective alternative for individuals who do not respond to valproic acid or who experience intolerable side effects. Atypical antipsychotics. Atypical antipsychotic medications, such as risperidone or olanzapine, can be used as alternatives or in combination with valproic acid in the treatment of bipolar disorder. These medications help stabilize mood and manage symptoms associated with manic episodes. In the case of migraine prevention, alternative medications to valproic acid include beta blockers. Beta blockers, such as propranolol or metoprolol, are commonly used for migraine prevention. They work by reducing the frequency and intensity of migraines and may be an effective alternative for individuals who do not respond to valproic acid or who experience intolerable side effects. Calcium channel blockers. Calcium channel blockers, such as verapamil, have shown efficacy in preventing migraines. They work by relaxing blood vessels and reducing the frequency and severity of migraines. Calcium channel blockers may be considered as an alternative to valproic acid in individuals who do not tolerate or respond to valproic acid. It is important to note that the suitability and efficacy of alternative medications may vary depending on the individual's specific medical condition and response to treatment. Consulting with a healthcare professional is crucial to determine the most appropriate alternative medication for each individual. Frequently asked questions about valproic acid. Can valproic acid be used during pregnancy? Valproic acid has been associated with an increased risk of birth defects, particularly when used during the first trimester of pregnancy. Women of childbearing age should discuss the potential risks and benefits of valproic acid with a healthcare professional. Alternative medications with a lower risk of birth defects may be considered. Can valproic acid cause weight gain? Weight gain is a potential side effect of valproic acid. However, not everyone may experience this side effect, and the extent of weight gain can vary from person to person. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can help manage any weight changes associated with valproic acid. Can valproic acid be taken with other medications? Valproic acid has the potential to interact with other medications, supplements, or substances, which can affect its effectiveness or increase the risk of side effects.